Without a proper healthcare system once, Singapore experienced its poorest life expectancy rates. In 1957, the expected lifespan of the population was 61 years. But from epidemics to medical advances, a young growing country found progress. According to the World Health Organization, in 2015, Singaporeans have an average life expectancy of about 83 years, the fourth best in the world. Meet Sarojini, Dinesh, and Amrish, family members from 3 generations who share the same calling, healthcare. Hear their stories as we trace the contributions of Singapore's healthcare professionals and the footprints they've left through time.
Nursing means nourishing, look after the young and the old and the sick. I liked it. I like nursing, I like to help people.
Meet Sarojini Nair. The 82-year-old is a retired nurse. But with 30 years in the job, there was no task that was too much for her.
My first time night duty, one patient passed away. So I have to sponge them and wrap them, everything. I work in the TB wards. They need everyday injection and they pump the air into the stomach to make the diaphragm go up so they can close the cavity of the lung. The injection the doctor will do, inserting the needle. The rest we had to pump up the air.
In 1821, Singapore's first general hospital was set up to remedy the greatest healthcare issue at the time, infectious diseases. But hospitals built in the early 19th century were not equipped to deal with the threat of communicable diseases. Dr. Jeremy Lim explains why in his book about the evolution of Singapore's healthcare system.
In the early days, right, the rich and the powerful sought healthcare in the comfort of their own homes. And it was only the indigent, as well as the sailors, who would need residential facilities. And so the first hospitals, they were really very, very rudimentary because they were built for really very specific purposes.
According to the Ministry of Health, in 1950, tuberculosis was responsible for 12% of deaths in Singapore. In 2013, that figure had been reduced to about 0.3%. One of the biggest steps towards fighting infectious diseases came from the improvement of hygiene standards during Sarojini's generation.
Those days the blood was in a bottle, not like disposable now. And then the technicians will sit and sharpen the needle and sterilize it. In the ward we boil instruments, needles, syringes, everything we boil.
1905 marked the start of the university system here in Singapore. It was very important because prior to 1905, Singapore was entirely reliant on doctors and nurses coming from overseas, coming from England, coming from India. But as the population grew, as the challenges that really Singapore faced became more and more uniquely Singapore, and the local community leaders lobbied very hard to have a medical school to produce doctors who would be Singaporean, Malayan, and who would have a vested interest to stay here in the long term.
The School of Nursing opened in 1956. Nearly 60 years on, the profession is thriving, with over 31,000 practicing nurses in 2014. Today, 1 out of every 2 healthcare professionals is a nurse. For Sarojini, her career as a nurse began in 1954.
We had a preliminary exam, anatomy exam, and we had a baby bath. How to bathe the babies. We learned how to make tea and how to make bed. And then how the patients die. We call it last offices. That time we sponge the patient and wrap them up in a white cloth. before taking to the mortuary. So I had to sit for a test. I passed the test and then I joined nursing in 1954 May. One whole batch, 13 of us only, small batch.
Sarojini's younger brother, Dr. V.P. Nair, remembers the hospital fondly. It was a place where he learnt the most after graduating from medical school in 1965.
In 1967, I was working at Accident and Emergency Unit of Singapore General Hospital, where I worked for a year. Those days, there were no handphone. We were given a pager. So what happens is that they will page us, and then we must be nearer to a telephone. Today, we have freedom, because anywhere you go, you can be contacted, either by SMS or by phone or by whatever means it is.
I remember my dad getting phone calls in the middle of the night. No matter what time of night it was, even if it was 1 o'clock, 2 o'clock in the morning, I would hear the door shutting as Dad went out to go in to help them. I felt this was indeed a very noble thing to do, and I thought that perhaps one day, if I had a chance, I'd like to do the same.
Today, VP's eldest son, Dinesh Nair, is also a doctor. Continuing the Nair family's aptitude for healthcare that started with Sarojini. She retired from nursing in 1983 when she was 50.
When the patient cry, I don't cry with them. I must console them. Other people's sufferings, you have to take it. I go home, I never think of all that. I go home, it's my family.
By 1990, the love affair with healthcare had spread to 12 members in the Nair family. After the break, we turn the spotlight on the next generation.
We're definitely fortunate to live in these times where healthcare is so good for everybody. We should never take it for granted.
Are you okay?
There's no greater sense of satisfaction than having saved a life or having made a difference to someone's life. It isn't all about saving lives, it is about giving people quality of life as well.
This has been the guiding philosophy for Sarojini's family, one generation to the next. Today, Dinesh is a specialist in interventional cardiology, a unique specialty within the world of medicine. One he wouldn't have been able to pursue during the early days of Singapore's healthcare.
Last time one specialist looked after many people, many types of sickness and all that. TB means one doctor, all that thing. And now asthma, different doctor. Infectious disease, different specialists. Everything different specialists now.
Today, 46-year-old Dinesh Nair continues his aunt's legacy of helping keep patients in good health. He treats over 100 patients on an average week. One of the things he studied was the outbreak of a disease in Singapore, dengue fever. The first outbreak of dengue fever in Singapore was recorded in 1960. It put 88 people in hospital. Dengue spread reached an all-time high in 2013. A record 22,170 infections and 7 deaths. In the following year, the National Environment Agency, or NEA, deployed 850 dengue inspectors who destroyed over 18,400 mosquito breeding sites. The NEA also stepped up its public education campaigns.
Through the 5-step Mozzie Wipeout campaign, essentially we try to reach out to the public to tell them that these are the top 5 breeding habitats that you could find in and around your home. It takes you maybe about 5 minutes to just do these simple steps.
A simple message for a complex problem. In 2014, 18,335 cases of dengue were diagnosed, a 17% decrease in the number of cases in the previous year. Diseases like dengue were responsible for 48% of deaths in 1975. Though it was the greatest cause of death in the 1970s, the decade also saw mortality rise from the few unexpected events.
There were a few big things that happened. I think the biggest of them all was the Spiros disaster, where there was a Greek ship in port in Singapore that exploded.
I was on leave at home, and suddenly I got a call that there was a Spiros accident in Singapore, and a Greek tanker in 1978 caught fire. And these burn victims, some of them were so charred that we cannot identify them at all. They were like a piece of charcoal. The clothes were burned. Some of them, I could even see the little bit of a face. So when they came, we had difficulty in putting up drips because the skin is all burned. Where to find a drip?
Out of the 167 victims on board the ship, 76 perished. The disaster tested the tenacity of Singapore's healthcare system and doctors like VP Nair.
It was a great learning point. The doctors had more experience in burns, number one. Number two, in an emergency, how to mobilize doctors from various organizations, not only the government doctors, even the private practice doctors came to help.
In 1983, Asia's first test tube baby was born in Singapore thanks to in vitro fertilization, a revolutionary procedure in Asia that gave hope to many childless couples.
It was really Singapore Healthcare's coming of age event, and it really sent a strong signal to the wider world, and especially especially to our immediate region, that Singapore medicine was of a very, very high quality.
Medical tourism soon picked up in Singapore. According to the Singapore Tourism Board, in 2013, travelers coming to Singapore spent $832 million on the medical sector. In 1984, MediSave, the first of the 3 M's of Singapore's healthcare, MediSave, MediShield and MediFund, was introduced.
If I take you back to 1948, when Singapore was a British colony and the mantra was free healthcare at the point of consumption. Fast forward to 1959, when Singapore attained limited self-government, one of the earliest things that then Prime Minister Lee Kuan Yew did was to introduce user fees. And it was this thinking that people had to be responsible that led to the evolution of what today we call MediSave. MediSave is a compulsory saving system. It essentially compels individuals to save for their own healthcare, but however, it was very quickly realized that healthcare is also characterized by unexpected, very, very expensive illnesses. And for this, the best way to protect individual citizens is through insurance. And hence, in 1990, MediShield was born. And the very last M, which we call MediFund, is essentially the final safety net. Patients who are unable to afford healthcare through a combination of subsidies, personal MediSave, and also MediShield can then rely on MediFund.
Many complex plans and policies have been put in place to improve the standard of healthcare. But for Dinesh, the drive to improve lies in the simple lessons that he's learned.
I remember the first patient under my care when I was a house minister, soon after I graduated, who passed away under my care. She was an old lady who was about 80-something years old. I learned that I couldn't save everyone, and I learned that I could only do the best that I could.
Coming up, our footprints through Singapore's healthcare journey bring us to the verge of a technological breakthrough.
The mindset that a patient has to go to the doctor to get diagnosed and treated has to be changed. So we're trying to rewrite intelligent software that allows the data from these wearable devices to actually be interpreted by both patients and doctors.
The dedication to healthcare didn't stop at Dinesh's generation. His younger cousin Amrish also joined the cause. But instead of treating patients, he's doing his part for healthcare with the help of his computer.
Although I studied something different, electrical engineering, when the chance arose to work in healthcare, I grabbed it at the first chance, and it seemed very natural to me to work with doctors, to deal with this sort of problems.
You can see the pump function's not so good.
At 29 years old, Amrish is 17 years younger than Dinesh. Amrish's youthful enthusiasm served him well. Diving headfirst into the medical technology industry immediately after he graduated from university in 2011.
Atrial septal defect, because the atrium is below and the ventricles above.
I got hired as a staff in NTU, dealing with heart signals, analyzing heart signals, using advanced methods from a company in the US. It's a booming industry. It's an industry with lots of questions, lots of applications where technology can be applied. It could be as simple as a watch. So, to simplify things, it could be as simple as a Fitbit that people wear now that could potentially diagnose cardiac disease. It could be as simple as a plaster on your chest that could provide data to doctors to diagnose many different types of cardiac disease.
The potential to integrate technology with healthcare is huge. What does this mean for doctors in the future?
I don't want to put half my family out of a job, so what we do is helping doctors do what they do best. Instead of doing the technological work, the legwork of having to run through hours worth of data, we save them all that time and we let them do their job.
One of the biggest threats to Singapore healthcare happened during an earlier part of Amrish's education. Severe acute respiratory syndrome, better known as SARS, arrived at our shores in 2003.
We experienced SARS when I was in junior college. There were daily temperature checks for 1 or 2 years. People with even the smallest cold or cough were sent right home.
Between March and May in 2003, 238 people were infected with SARS. Among them, 33 died, 5 of them healthcare workers.
I remember very vividly all of us not knowing what was happening. There was this new disease out there that we did not understand. Colleagues, friends of ours were falling sick with these diseases as we treated patients. And there was an element of fear going all through the country.
Healthcare workers, to some extent, were treated quite differently. Whereas the use of the term ostracized would be too strong a term. Certainly people avoided people who were obviously healthcare professionals. Taxi drivers that were not so well informed, for example, would not even carry nurses to hospitals.
But the 31st of May 2003, the last SARS case was diagnosed and isolated. Singapore was removed from the World Health Organization's list of affected SARS countries. Critical lessons were learned during the SARS crisis. After that, major hospitals made sure they had isolation rooms and a stockpile of medical supplies such as N95 masks.
What we learned from SARS did help us to deal with subsequent threats of an infectious nature, whether they were H1N1 or bird flu, MERS more recently, and even Ebola. Examples, apart from the fact the early identification, case definitions, they included temperature screening that we carry out at source, at points of entry, for example, at our airports and even at our land checkpoints.
As healthcare improved, costs rose. The Consumer Price Index in 2014 registered a 23% increase compared to 2006. MediShield Life will come into effect on the 1st of November 2015. It's a mandatory basic health insurance scheme that will replace MediShield. MediShield Life promises lifetime coverage for all Singapore citizens and permanent residents.
Everyone, every single healthy person pays into the fund. Every not so healthy person also pays really into the fund, and hence there is a subsidy from the healthy persons to the not so healthy persons. But because this is spread over one's entire lifetime, none of us know at what point perhaps we may become one of the not so healthy persons, and we would then benefit from essentially from this medical safety net.
The benefits of MediShield Life include higher claim limits for outpatient treatments. This means greater coverage for the #1 killer in Singapore today, cancer, the cause of 30% of the nation's deaths.
The nature of the way that we treat cancer, it has changed. Today, the medicines are much gentler on the immune system, they're much gentler on the body, and so these can be taken on an outpatient basis. So it then becomes necessary to expand funding on an outpatient basis. Otherwise, we may run into this very perverse scenario where patients who don't need to be hospitalized stay in the hospital simply because that's where the reimbursements are.
Healthcare here has come a long way since its early days of providing basic survival. In 2014, Singapore came out tops in an annual ranking by business news agency Bloomberg of the most efficient healthcare systems in terms of the cost of healthcare against life expectancy and other factors.
We're definitely fortunate to live in these times where healthcare is so good. It is something that we worked very hard to achieve as a nation, as a healthcare establishment. Doctors, nurses, allied healthcare working together to be able to achieve this. We should never take it for granted, no.